Hello, everyone. Welcome back to StatTech Research's seminar series on measuring progress and well-being. I'm Kelsey O'Connor, one of the organizers. Today, we have Emma Lawrance, who will discuss climate change and mental health. Before starting, I wanted to just remind those of you who are coming to the International Society for Quality of Life Studies annual meeting. This year's the 30th anniversary, and we are hosting in Luxembourg. The early bird deadline is coming up in, I think it's 5 days now, on the 30th of March. So if you want to have a lower registration, now is the time to do that. Back to today, Emma will speak for around 40 minutes and then address questions at the end, at which time please raise your virtual hands or post your questions in the chat. During the presentation, please keep your microphones muted. And as a last reminder, we are recording the event. You'll be able to find this and past recordings on our website and YouTube channel. Now to introduce Dr. Emma Lawrance. She leads the Climate Cares Center at Imperial College London. She works with diverse experts to better understand and respond to the interconnections between climate change and mental health, including through the Connecting Climate Minds Global Initiative. She holds degrees in physics, chemistry, science, communications, and neuroscience, and loves being outdoors, particularly in her homelands of the Adelaide Hills. And if you heard before, this is a subject I know too little about. Very much looking forward to hearing what Emma has to say. Emma, without further ado, the floor is yours. Thank you for joining us.
Yeah, thank you so much for having me, and a pleasure to be with you all today. I got quite excited thinking about the idea of measuring progress, and will hopefully share more with that you haven't heard before around the nexus of climate and mental health, but also how we can consider the ways that we measure the impact and we measure the progress in responding. So, as Kelsey's already kindly introduced me, I'm from the Climate Care Centre. And just to tell you briefly about us, we're situated at Imperial College in London, between the Institute of Global Health Innovation and the Grantham Institute for Climate Change and the Environment. And we work on research, but also policy, intervention design, and education and awareness raising. And we get to work really globally, which I'll come to as well. So one of the ways that we work really globally has been through connecting climate minds. The reason that I'm bringing this up now is because I'm going to be drawing on quotes and insights from this initiative in some of what I will discuss today. Connecting Climate Minds was a Wellcome-funded global initiative that happened over the last couple of years, and it had the main goal of building a research and action agenda for the climate change and mental health field. And we did that through a really participatory process. So we built communities of practice in all 7 Sustainable Development Goal regions that included convening organisations, co-conveners, youth ambassadors, and lived experience advisory groups who were interfacing with people from countries all across their regions and from different backgrounds and expertise. We also, at a global level, had a lived experience working group who led their own research and action agendas by and for young people, Indigenous communities, and small farmers and fisher peoples. And lived experience was embedded in each aspect of the project. And we also, so it was us and the Red Cross Red Crescent Climate Centre who were helping with global coordination and methodology, but really interfacing between the global and the local. So this was just some of the global spread of the lead organisations, but again, they were bringing in all sorts of people across their regions. We had regional dialogues. So in each region, we had 2 dialogues, one on understanding emerging needs and generating priority themes for research. And the second, and the how, which will also come into today, was how best to conduct this research, and things like how do we measure and how do we translate evidence into action in policy and practice and achieve progress. And we also had 3 virtual and 4 in-person dialogues for young people, Indigenous communities, small farmers and fisher peoples. And that included now, so just in the dialogue, so it was 870 participants, but over the course of the project, we had like 1,200 people across over 127, I think, ish countries. And that led to 10 regional and thematic agendas, 25 case studies, and 35 lived experience stories. So what did we hear? We'll come to that in a moment, but I just wanted to set that context so you know where some of the data is coming from. But back to why we're talking about mental health and why we're talking about climate change and their nexus. So mental health is a growing global concern. You can see from this figure on the left that when adults under the age of 75 were surveyed across 31 countries, their top health concern, their biggest health problem they saw facing people in their country for the last couple of years has been mental health. And yet, less than 2% of national healthcare budgets are dedicated to mental health. And in many parts of the world, there's almost no formal mental health care. And what we're seeing is sadly rising rates of what appear to be true rising rates of mental health need. Of course, in some parts of the world, there's been a rising awareness, which has led to hopefully more people seeking help, and that can lead to rising diagnosis and treatment as well. But there seems to be a true rising rate. And this Lancet Psychiatry Commission last year said that global megatrends have contributed to that, including climate change, and we're entering a dangerous phase. On the other hand, many of you might know that we're living in a critical time where the boundaries of what our impact on the world that would enable us to sustain life on Earth and a habitable planet are rapidly being crossed. So you can't really get more serious than that. And it's been said that any further delay will miss a rapidly closing window to make sure that we do secure a livable future. A lot of people get this. So the majority of people around the world actually want climate action and support climate policies much more than people think they do. So when you ask people how much they support these policies or they want this action or they would pay money towards this of their own pocket, the majority agree, and yet they think they're in the minority. So how do policies in practice align with these desires, and how do we support people through change? And one key thing is the IPCC reports, the International Panel of Climate Change, has said that resilience in their definition is not just the ability to maintain essential function, identity, and structure, but also the capacity for transformation. So I'm kind of leading to this point of climate change and mental health, these crises being deeply interconnected, where the way that we're affecting the planet as humans, the hazards that are being created through changing climate impact our mental health in ways that I'll describe. But then also our capacity to deal with this, our resilience, our capacity to cope and act can be limited if we are not appropriately supported. And actually that action requires an understanding of our psychology. So if we can flip that vicious cycle in ways that I'll also describe, there is the potential here for a virtuous one, because the state of our mind also impacts the state of our world, and the climate and ecological crises are fundamentally attributable to human behaviors and psychology. And we need to be thinking about how we create social tipping points, which again, I'll talk more to. But so in this first part of the talk, I'm just going to outline what are these pathways and mechanisms of impact? What are the climate exposures we're talking about? What are the mental health outcomes we're talking about? And then talk about how some of this is being measured and addressed, and what are the challenges and opportunities. So this is a figure from a briefing paper we did about 4 years ago now. We released it to try and emphasize how there is a whole spectrum, a whole continuum of ways in which climate is ultimately impacting mental health. So as global temperatures rise and there's more extreme climate and weather events, we're seeing more people directly affected by experiences of extreme high temperatures and loss and damage of homes and property. And this has effects that I'll go on to describe on mental health, but there's also these flow-on effects on forced migration, damage to crops and livestock, food and water shortages, rising food prices and cost of living, loss of habitats, loss of culture, cultural practices, community breakdown, disruptions to health systems and education, changes to livelihoods, conflict, and all of this on the other side, we're witnessing this, and people are bearing witness to this. They're learning about this. They're wondering what this means for their present as well as their future. And So there's a range of mental health outcomes that can be affected. And so mental health often gets talked about as if it's a monolith, but of course it's a huge nuanced space. And yeah, we'll unpack that a lot in this conversation. I'm talking about things like sadly increased cases of suicidal thoughts and deaths by suicide, but also increased symptoms and new cases of diagnosable mental illness, increased susceptibility to physical ill health or death for people who are already diagnosed, worsened population mental health, and mental and emotional distress. And this will cost, there's been an estimate that this could cost from this extra burden nearly 50 billion per year by 2030, escalating to over 500 billion per year by 2050. So what is the nature of the evidence for these impacts? So last year there was an umbrella review for the first time of the global evidence, and they looked at 32 systematic reviews, and it's still emerging. And most of these involved air pollution, which is both has common causes with climate change, but also is affected by rising temperatures and humidity, and things like wildfires. And most of them within climate change hazards focus on temperature, and most of the outcomes are on mental disorders and suicidal behavior. And I'll outline some of their results as I go through and include other studies. But something that's important that they noted was that the associations between a lot of these effects, because they're at population scale, can be relatively small, but because the entire world is being affected, that can have a substantive impact. When we look at the sort of left-hand side of the continuum, first of all, talking about temperature, a study that I was involved in, a systematic review and meta-analysis, we found, among other things, that there was around a 10% higher incidence from a meta-analysis of hospital attendance for psychiatric disorders during heat waves. And it's been reported to the UK Environmental Audit Committee that suicide risk can be twice as high in the UK when the temperature was 32 degrees rather than 22 degrees. And this same umbrella review found that there was highly suggestive evidence that as the temperature goes up, that there's increased risks of suicide or deaths related to mental disorders and suicidal behaviours, as well as hospital access for those experiences. If we think about extreme weather and climate events, things like, so an extreme weather disaster, things like a typhoon, a flood, a storm, a wildfire. This is from data from Australia, where I'm from, and Australia has been very hard hit in recent years. Obviously, it has resources that other countries don't to deal with that. But despite that, the vast majority of people who had experienced at least one extreme weather disaster were experiencing anxiety. Half were experiencing depression and sleep disruptions. A third were experiencing symptoms of PTSD. There's impacts on substance misuse and exacerbating existing problems. And again, from the umbrella analysis, the temporal proximity of cyclones was found to affect post-traumatic stress disorder. But there's been a whole range of studies looking at links between different climate and weather events. And of course, that they predate what we would sort of call climate change, because of course, these disasters can occur naturally, but are being exacerbated both in severity and in frequency by a changing climate. And that means people don't have time to recover often before the next one hits as well. And often it is like a small increase in severity can have a huge increase in impact. And it also means there's more likelihood of reoccurrence. And it's when those things happen repeatedly that we can also get more risk of long-term mental health challenges and cumulative tolls. And they can be very long-term. And also, if it's in childhood and for young people, it can be an adverse effect affecting them later in life as well. When we think about air pollution, we see that from burning fossil fuels and from things like wildfire smoke, and also a changing climate provides the conditions like heat and humidity that can worsen existing pollution. And we see, again, this has been linked in various studies to a range of mental health, and neurodevelopmental and neurodegenerative disorders, particularly things like dementia and Alzheimer's, for instance. And there was good evidence or very convincing evidence, the highest class of evidence in the review for long-term exposure and a higher incidence of dementia or cognitive impairment. And there are all sorts of effects, like there's emerging evidence, and this is in the review, found that during the second trimester of pregnancy, exposure to particulate matter was linked to postpartum depression. But there's also been other work finding that actually if the growing child in the womb is exposed to wildfire smoke, for instance, that can have effects on their risk, throughout their childhood, adolescence, and later in life. And also schizophrenia relapse has been linked to exposure to sulfur dioxide in this review of reviews. There was strong evidence for that, but there's other evidence emerging. It's a very dynamic area, and these links are being kind of constantly strengthened. So what does that mean for people? Most of the time, these effects don't actually happen one at a time in the way that I've just described, but they interact. So when we looked in Connecting Climate Minds, for instance, there's so many quotes I could share with you, but I'll share a few today. One of the participants said, it's been the most stressful thing to observe how not just the air, the visibility, how we're living in the city in the hot later months of the year. So even my friends who I've asked, my family members, they don't feel comfortable going out. It causes severe headaches and has caused us lots of stress just in general. They talked about, children not being able to go out to play, being trapped in their homes, not being able to exercise, not being able to see friends because it's so hot, and the impacts of that social connection loss on them. And psychiatrists were talking about how they see their patients worsening because they're effectively trapped in their homes. So these are very dynamic and ongoing effects. So I don't know what's happened here, but just to again show you the dynamic nature of the effects and how widespread and systematic, and we need to think in a systems lens. If we look, for instance, at burning fossil fuels, that leads to air pollution. If we look at changing climate, we get extreme weather events, there's climate impacts, but there's also flow-on effects on agriculture, on supply chains, and on markets. And these can have effects across the whole life course, and even intergenerationally and across geographies. So a drought can happen in one region, and that can affect food security, for instance, in a whole other region. It's very systemic. And if we think, just again to highlight the interconnected and systemic nature of these issues and how climate acts as this kind of cascade, this risk multiplier for mental health through a variety of pathways, we see that if women are exposed to malnutrition or famine during a pregnancy, there's a 2 to 3-fold elevated risk of psychotic, affective, and personality disorders for their children. And these connections are also work both ways. So, for instance, in the UK in 2024, people living with mental health conditions were twice as likely to be living in food insecure households. But also, when you suffer from food insecurity, that can increase stress, anxiety, depression. So there can be this sort of vicious cycle generated. And now, kind of thinking back to that right-hand side of the continuum, we are not only, even me giving this talk, so far you may have, and I promise we'll get to a more holistic picture and what can happen if we kind of flip this scenario, and ways to do that and how to do that. But just listening to this and being aware of this can generate a lot of uncomfortable emotions, and you might be feeling already like, frustrated or scared or overwhelmed or angry that more is being done, or just feeling almost like numb to it. You've heard so many maybe bad things about what's happening in the context of the climate crisis and the injustice that's being perpetuated by a very small number of people and companies on the whole world. And that is very understandable. It's not a mental health condition. It's a sign that you care, a sign that you're connected to your feelings and to the world. We need to understand and give space for those emotions and those responses, and leaning into them can actually offer us ways of being able to feel more love and joy for the world as well, and more meaning and purpose in the way that we're responding to the situation. Um, but without that kind of support and without that kind of space, these so-called negative emotions can be linked to poor mental well-being and things like insomnia. And just while distress can coexist with high well-being, if we have meaning, hope, and agency, and it can link to taking action. There is also, of course, aspects of distress that can become paralyzing, impair function, worsen mental health, and worsen our capacity to act. And we've heard this, for instance, like farmers, a woman who's working with farmers in Kenya saying, well, people come to talk about drought-resistant crops, but no one can take action if they can't get out of bed in the morning because they're so kind of worn down by what's happening. And the challenge we have to acknowledge is that these things don't occur in isolation. So we're getting these repeated kind of hazards at the same time as this disruption for the conditions that we need to support good mental health and well-being, and this sort of undermining of what is called the social, economic, environmental determinants for good mental health and well-being, and our psychological and emotional responses to this, and the narratives that we hold and are told in society, in ourselves, and how do we unpack that, and what do we do in light of that, especially when this sits in the context of what has sometimes been termed the poly crisis, but these all interact. Biodiversity loss interacts with climate, interacts with cost of living crises, forced migration, conflict, physical health effects, structural inequalities, and pandemics. And it's really by understanding how deeply we're interconnected to each other and to the world and the environments that we live, and our health cannot be taken separately from the health of the wider environment. We can see a source of opportunity as well as challenge. And this really came across, this isn't a new idea, of course, science is showing this more and more, but of course many cultures and communities around the world already have known this and talk about this in different ways. And we had this in Connecting Climate Minds from many of the Indigenous communities, for instance, talking about things like, again, all of the quotes are so powerful, but talking about things like when our life spaces are healthy, we are well. In a sense, climate change is being seen much more holistically. We're looking at what, again, are those intergenerational violences that we need to deal with. Some of it came through climate change. Some of it came through the terrible extraction practices. Others came through setting up systems of slavery. They're all mixed together. And they're often all the same mindset or the same practices of thinking that we can extract without boundaries and without consequence. There is too much extraction, said someone else, out of the lands, but of us too, the mining of the spirit, the human being, the lands. And you can see it in the mental health of our people. We are being mined, and you can see it in the mental health of people. We are empty shells. I mean, it's very, very powerful words. And so it is Indigenous communities that are among the most vulnerable, but also people working in climate-related careers who are facing this kind of information and knowledge day in, day out, and really working and can be prone to overworking in response to what feels like the urgency and understandable urgency of the situation. Also, children and young people. Most mental health disorders begin before the age of 24, 50% before the age of 18, but they're often very exposed around the world, and a lot of the countries that are more exposed to climate impacts, indeed the whole continent of Africa, is one of the youngest places in the world, and yet they haven't contributed also intergenerationally to the issue, but are facing this burden. Also, people with pre-existing mental illnesses or vulnerabilities. For instance, 8% of the people who died in British Columbia in the heat dome in 2021 lived with schizophrenia. And also people experiencing more direct climate impacts, and those with limited ability to adapt, and those whose livelihoods and cultures are strongly connected to the land, like farmers or fisher peoples who we worked with. So overall, where is it at, and what does it look like in terms of solutions, and what does it look like in measuring progress? So the Lancet Countdown, some of you might have heard of, develops metrics and indicators for climate and health. and they have done this across a range of health outcomes, but they haven't yet been able to do it in a really kind of robust and broad way for mental health. Um, and that's a challenge for various reasons that I'll go into, and they, particularly around the patchiness of global data and a lack of resource that this field has had. And we really need to bring a transdisciplinary field together to act on this. Policy has also seen historically there was big silos between, and still to date a lot of silos between different cultures, different disciplines, different sectors, and when the response needs to be so uh, interconnected because the challenge is so interconnected, we really need that interconnection to be centered in the solutions. We've started to see change. So we released a policy brief, the World Health Organization did the year after and cited ours, which was great. I was involved in that. The COP 28 climate conferences a couple of years ago had a declaration, or 18 months ago had a declaration on climate and health, and we made sure mental health and wellbeing was included in that. And the IPCC latest round of reports also included an explicit section on mental health, noting that there were data gaps, but also throughout talked a lot about resilience and well-being in ways that were really useful. So what we see is that there has and there was, before we did Connecting Climate Minds, the need for a research agenda. And some of the key gaps we saw were in the mental health burden, including costs. And this is kind of key for this group not yet being fully measured, particularly for those worst affected. The ways in which climate change impacts mental health are not fully understood and outlined, all of those different pathways and mechanisms, which makes it difficult to attribute. The mental health benefits and risks of climate action are also not being measured, and evidence is lacking, including how we measure that on appropriate mental health interventions. How research is done is as important as what research is done, but currently, as I said, there are disconnections, it's unequal, and it's pretty siloed. And mostly research has been done in certain geographies and topics. This is starting to change, but again, there's big gaps. And those geographies are mostly global north richer nations. So as I said before, if anyone's interested in this, please go to the link at the bottom of the screen, hub.connectingclimateminds.org, and you can see all of these agendas that came out. And the 10 agendas were synthesized into a global agenda. And I just wanted to talk briefly about some of the things in the global agenda. And what we heard was the need for foundational field building. We need to there were emerging themes around the terminology, definitions, and concepts in this space, methods, metrics, and data sets, which again important to unpack here, and I will in a moment. And exists, but also about how we don't reinvent the wheel. There's so many existing knowledges, practices, and interventions, both emerging and that have previously been practiced by different cultures and communities, but also different methodologies and different disciplines that could be applied to this space. Our 4 high-level research categories were the impacts of climate change on mental health risks and mental health risks and protective factors, pathways and mechanisms by which climate change impacts mental health benefits and risks of climate action, and mental health interventions in the context of climate change. Overall, we'd love you to read the details, but some of the things we heard were around these compounding risks and interacting pathways, and how relevant knowledge and solutions are held in diverse disciplines and cultures, but also the diverse expressions of mental health and climate change. And so we need to develop shared terminology and definitions while acknowledging diverse conceptualizations. Even something like resilience or adaptation would be understood very differently if you asked a mental health person to define that, or a climate sort of, practitioner, professional to define that. What does this all mean for measurement? One thing, and I sort of noticed before, is that we need to distinguish between climate versus climate change. And one of my collaborators globally has been working on a paper on this that's just been submitted. So, we need to be clear around, how, when and how is it important to distinguish, but also to note that what we're learning about the effects of temperature on populations, for instance, some of it's applicable even if there wasn't a change in climate, because we're not fully adapted to the spaces and the places that we already are, which means that adaptation action is good even if there wasn't a change in climate. But of course, especially important in light of a change in climate, but is good now, has current benefits now, payoffs now. Also about local versus global, we heard really diverse cultural understandings of mental health and of climate change and the way that that's expressed. And we need to take that into account in measurement. There's big data gaps. Mental health is, there's big issues with stigma, with and just with lack of data in many parts of the world, and access to different data sets. But that doesn't mean that there's not impacts. And we really heard such strong testimonies of that around the world in Connecting Climate Minds. And if we want to attribute which aspect of the mental health burden is attributable to different climate-related exposures, climate change-related exposures, there is a complexity of these compounding and interacting pathways, and this is really a systemic risk. So what does that mean? Just to give you an example, and I don't expect you or want you to read the details of what's in here, on the slide, I mean. This paper that I worked on ambient temperature and mental health, we have a huge SUPS section, supplementary materials, where we laid out all of the different climate temperature measures and metrics that we used, all of the different mental health measures and metrics that we used. And it is so diverse. So if you're interested, go and look at that. But it's so heterogeneous. And just as one example, for measuring ambient outdoor temperature, there was absolute temperatures, there was temperature variability, so relative values, there was heat waves and extreme temperatures. And all of these could be measured differently as means, as maximums, as minimums, as deviations across different time periods. This list on the right is just the various definitions of heat waves. And of course, then it makes it really difficult if you're trying to do some sort of consolidation of that data. And there's also challenges with the scale, both geographically and temporally, of the data that's collected for things like temperature or things like mental health. Another source of heterogeneity in measurement is around the scales that we're using. And this is a challenge for mental health in general, but then it's exacerbated in the context of the climate crisis, because the way that mental health is measured, organizations have been trying to come up with and promote that these are kind of the standard ones that we should use to try and be more systematic. And there's efforts in global mental health to make sure that those are adapted, culturally, locally relevant, etc. But there's also in this kind of climate psychology space of which is a term some people might use to understand these psychological thoughts and feelings in the way that we respond, and to awareness of the climate crisis and how that interacts, and that does interact with experience of the climate crisis and with mental health outcomes. And there are so many different scales emerging. So 65 came up in a search that we've been doing in literature from the last years, focused on climate and mental health in young people. And this is just a taster, and it's difficult to see what aspects of the space they span if you just read something like climate worry versus climate anxiety versus climate distress and impairment, versus eco-anxiety, to really grapple with the different aspects of this experience that are being captured. And part of that is because these experiences are complex and nuanced. And to that, in terms of diverse expressions culturally of mental health, in East and Southeast Asia, for instance, and again, there's so many quotes on this I could share, but they said, for instance, the term mental health is not necessarily something that communities use on an everyday basis. So we need to localize it in culturally relevant ways. In the Indigenous dialogues, we heard things like, anxiety is a Western construct. The language of management, the language of crisis is not our language. And giving energy to mental health in isolation, to well-being, and this idea of being interconnected to land, culture, spirit, physical health, communal health, social health. And if we take it outside of that, it's biomedically introduced and reductionist in a way that inadvertently disempowers Indigenous understandings and Indigenous solutions. And one of the challenges would be the language that we use to discuss with the community. They said in the Central and South Asia dialogue, we need to understand very clearly what we are asking them is the same meaning to them as it is to us. In the work that I quoted right back at the start of the talk, and if you remember, I mentioned that there has been one estimate, so far as what I know, of the cost of this globally, of 4 billion USD per year by 2030 and over 500 billion per year by 2050. And just to say, the way that they did this is they sort of looked at the doing estimates of the prevalence and of the cost, and they had to adapt the data from what they had in different countries and different contexts to what they could project for similar countries and contexts, to develop these predictive functions for both prevalence and for the cost, and to convert that to what then we would imagine to see into the future. But again, this is something I'm sure could be built on. Another area of progress is in, just to note, I found this really interesting, is in actuarial science. So, when we think about insurers and insurance, they're a part of society that really understands systemic risk, and this is something that is really not taken into account. I'm working on a paper at the moment that with someone from the Stockholm Environment Institute, and he said that in climate models at the moment, risk models, they just don't take into account all of these systemic, lifelong risks, intergenerational risks, diverse spreads of risk across geography, etc., from these cascading things like the impacts of mental health. It's not included. And so there's people coming into this space like actuaries who are saying we can use our methods to measure this, and look at what these true risks are, and develop policies based on our best guesses of the worst case scenarios.
Emma, we should wrap up in about 5 minutes.
Okay, sure. Sorry, I will try and be a bit quicker. I'll just quickly go.
No problem.
Yeah, I'll quickly go through how, just to say, because of these interconnections, climate action is also mental health action. So, and I want to end really with what is possible, and I'll talk you through as briefly as I can, and might have to do it very briefly, some case studies, but just to know if people are interested, I can share the slides and you can see more details of that. So because these challenges are interconnected, action has the opportunity to benefit multiple things at once. And actually, we are creatures of imagination, of vision, of possibility, and we can really start to live and act the future that we want to see. And because the future isn't here, right? We're creating it all the time, and we need that vision of the future. But it's this opportunity to redefine the social and environmental determinants of health. And what we see in the data is that there are clear co-benefits or win-wins where climate action benefits mental health, including in the energy efficiency of housing, increased active transport, increased access to nature and blue and green spaces in communities and cities, and more social connection. And social connection is vital, and psychological resilience is vital for us to cope with and act on what's coming. But it's also, we all know that social connection, probably from our own experiences, but also in the data, is really good for mental health. And we see this in the IPCC reports, for instance, how they see that they don't frame it as mental health, but how in places where there's more trust, more effective governance, where there's more equity, better living standards, there's also can be reduced emissions and higher well-being. And this can happen across the life course. So if we're talking about things like stopping burning fossil fuels, that has to be the key, fastest thing we do, but also school-based interventions, community-based mental health care, and opportunities to strengthen social bonds and connections to nature. There's solutions to a range of kind of social ills and ills for our mental health that can be realized through these climate actions. And there is already work that's existing on the ground around the world. Most of it is in the grey literature rather than the academic literature, and some of it's not captured at all because there just hasn't been research funds for evaluation, but also those tools and metrics necessarily defined. But we're starting to look at this. So we've been looking at, in terms of policy space as well, we've been evaluating the health national adaptation plans, and heat health action plans. Again, I'm happy to go into details in questions or to send these slides. Sorry, taking too much time. But just, yeah, there's very little that's happening, and there's a lot of space for us to come in and realize these win-wins. There's lots of examples of where this is already happening around the world that, again, I can share with you later. The World Bank is also starting to do this by looking at the cost of inaction of climate change on health, and we're feeding into a report on mental health for this at the moment as well. And there's some people that have started to measure this. So in South Australia, where I'm from, they've looked at public heat health warning systems, for instance, and although implementing that, including supporting people who had previous mental health conditions, cost essentially 600,000 Australian dollars. The cost savings for health were massive. Similarly, things like housing retrofit, both in Ireland and in Victoria and Australia, they've found that that can reduce mental health issues, and that is effectively very cost saving. I found that in Australia as well. So for every $1 saved in energy, $10 was saved in health, and this persisted over 2 years. And similarly for building psychosocial resilience, and for integrating climate and mental health education. If anyone wants to know more, we also have a course on climate change and mental health that also outlines a lot of the case studies and solutions that you can join up. And I will stop there. Thank you very much for listening, and apologies that the solutions got less airspace than maybe some of the challenges, but yeah, I'm happy to share more afterwards. Thank you for that.
Thank you very much, Emma. I'm sorry to have rushed you, especially on the solutions side. Very interesting. And I think we have some overlapping research and just from a different perspective. So I'm curious what my colleagues will have to say. But with that, we'll open up the floor. Please feel free to raise your virtual hand or to write in the chat. And I think I can start off. I like what you said about numerous things, but this is systemic, it's compounding. There are so many intertwined aspects. The difference between climate and climate change. And then there's this estimate that today it's about $50 billion in cost. Do you think it's even possible to estimate the total costs of, I'm going to use the word climate change right now? And although at the same time, I feel like that's necessary in order to communicate. So maybe you could tell us a little bit more about that one study, or the feasibility of doing this holistically.
Yeah, thanks. So we're actually in conversations with people at the moment about kind of ways to do this and extend this work. And so I certainly think it's possible, but also with some limitations, right? And there's sort of some assumptions that will have to be made. There's some data gaps, but it feels a little bit chicken and egg at the moment, in that if you don't start, we also need to develop a sense of what is possible, but also where those gaps are, what data can and needs to be measured going forward. So we can also be advising policymakers. We can also be, advising researchers who are often working on, climate adaptation projects or climate and health work that could easily integrate mental health within that, but don't at the moment because they don't know what to measure, for instance. And so there is an opportunity to do that. I know some colleagues who are working in climate attribution, so they do or world weather attribution. So essentially they look when an extreme event occurs, which is of course occurring more and more frequently, they look at how likely that or what was the contribution to that event of anthropogenic climate change. And they were interested in extending that then to health outcomes, mental health outcomes. If they could do that, that would be extremely powerful for things like litigation as well, right? Like, so So sometimes you're like, well, we know that this is a burden on people. Why do we even need to sort of have these numbers? Because certainly when you talk to people on the ground, they don't care about the number, right? Like they're like, I'm being affected. You know, we know what a lot of the solutions need to be. We should be able to put them in place without necessarily knowing that number. But in terms of policy change, or in terms of climate mitigation, in terms of these kind of things, it is very useful to have that number. Um, there were challenges in terms of the scale, like the temporal and geographic scale of the mental health data that they could access in this particular example versus uh, the kind of relevant weather data, which made it difficult. But there are examples of people doing more kind of causal attribution studies now, like a colleague who looked at like placental tissue after like one of the big storms in the US and found like epigenetic like changes and biomarkers and things like this that relate to then mental health outcomes related to the kind of stress that had been experienced by the mother and like of course like controlled and all of these things. So that's a different way of kind of doing attribution. But in terms of this overall, like can we put one number on these costs? I think that it's definitely difficult because there's so many different aspects to it and it will take time to build up. But I also think it's important to start somewhere and start doing it and building on it.
Because it feeds into this cost of inaction. So
Hmm.
if it's worth investing 10 billion, then we save at least 50 or however much.
Yeah.
Okay, I'll
And I
stop.
think it's powerful that when people have measured in studies where they've taken a climate adaptation through these energy efficient homes, for instance, quite a modest investment in retrofitting, the energy saving costs, were there, but it was like 10 times greater the health saving costs. So unless you account for that, it really changes the conversation, right, of what the costs and benefits look like.
Mhm. I'll follow up after that. But before, Yevgeny, please feel free to unmute yourself and ask away.
Hi, thanks for this interesting presentation. The topic is very challenging and really caught all of my attention. So my question is, would it be possible, or maybe there are some papers which already do that, which compare the outcomes of COVID-19 crisis, like in terms of the mental health versus some major shocks to the climate, for example, earthquakes or some abrupt shocks in temperature or something like that. And I have another little question. What about differences between cities and rural areas? Are there major differences in terms of the impact of climate on the mental health of those inhabitants? Thanks.
Yeah, great questions. I mean, part of the answer is that there are big gaps in the data as a whole. Like insofar as there's lots of questions to explore in different parts of the world there. But to answer your first question about COVID versus climate, so again, there's different mental health outcomes and different climate related exposures that you could compare COVID to. And of course, it might look different in different contexts and different places. One example from my end is that we did a survey study in 2020 in the UK. So it wasn't in the context of a climate event per se, but it was in the context of climate awareness, where we were asking young people a whole series of things about, and we had scales for kind of climate related distress, COVID related distress, where it was the same scale but sort of adapted, and the positive and negative impacts on their life, how frequently they worried about a whole range of things for their future, including the pandemic, including climate, including jobs, et cetera, et cetera. And then and the sense of agency they had to respond to both, the emotions they felt in response to both. And we had both of those in the one survey. And I would have thought, living in the UK in 2020, that COVID would have been a much bigger source of distress because it was clearly more negatively and directly impacting the young people's lives. And it came out, of course, that the biggest disruption to their lives was, of course, because of COVID. But their distress, or really their concern about climate, was significantly higher than it was for COVID. And for the 10% of the young people in 2020 who were the most climate distressed, when you ask them how frequently, even as a UK citizen, relatively protected, they worried about climate change, or they worried about a whole series of things for their own future. They said they worried most frequently about climate change, even though the other things were like jobs, relationships, politics, pandemic, etc., etc. So in that sense, and but interestingly, there are also things like they felt more guilty about climate change than COVID, but they felt less like their actions could address it. So you get these interesting things where people feel guilty, they feel overwhelmed, they feel like they can't do anything, but they also so they feel like their actions are negatively affecting, but they don't know how to positively affect. And I think that's a result of really powerful narratives that have been driven by the fossil fuel industry around like the individual footprints and burden and things like this. But but it's an interesting point around the wider point of different types of disasters and also how these disasters compound each other in individuals and in different contexts. I think rural versus city. So there are things where it'll depend on different communities. There's different pressures in the different places. So there's this sort of urban heat island effect. So living in cities, people can be exposed more to the extreme heat, but also like we see farming communities and indigenous communities and people whose life or lifestyle is strongly linked to the land. They can be really affected, their life, their cultural practices, their livelihood, their economic future by these impacts, and they might have to actually migrate to the city. So we see these like changing patterns as well. So I think it's not as simple as saying who is more affected, but there's these different kind of patterns to unpack. Yeah, I don't know if that helps.
Thank you.
I wanted to follow up on that. Actions to address it. So you have, I guess, people across the demographic range. So the indigenous peoples, young peoples. Are any of them suggesting things? Are they, saying this is what we should do in order to address climate change?
Yeah, there's a lot of solutions already. I mean, I think part of it is also seeing it as a systemic response, and also they want to have, I can't speak for everyone, but they want to be part of the solution and have their communities, local solutions be put forward. So, and this can occur on many different levels. So, for instance, as it's one example, in Australia, just as an example of something that has been measured, there are these, there's been an initiative with First Nations Australians called Caring for Country initiative that was evaluated where the First Nations like leaders of this program were doing traditional land management practices in ways that like basically locked more carbon like in that environment, was climate adaptive and responsive, but also had big mental health and well-being benefits that were measured for that community that was participating in that. So again, there's these kind of win-wins, and there's been, I guess, there's a lot of solutions that also come from, strengthening kind of social resilience of communities, which can come from cultural practices, which can come from, participating in ways to like green their environment, in connecting with nature, in in all sorts of different ways. I mean, it also depends on what that community is most affected by, most wants and needs. There's, I know someone, for instance, in Kenya, who's an amazing farmer turned clinical psychologist. He's now working with women in the farming communities who are often, a lot of smallholder farmers are women, and teaching them about like mental health care, about social resilience, identifying people in the community who are really struggling and referring to support, building resilience of those groups. We really strongly heard, like in the farmers dialogue, for instance, the difference of social support for whether people have big mental health impacts after these events or not, and whether they can take action or not. And if they can take action together, that also helps with things like food security and stuff, because when we heard about, farmers kind of giving up, but then the whole community becoming less food secure because there's less farming happening, for instance. So but yeah, I mean, at a global scale, there's a lot of solutions as well if we move to basically move to burning less fossil fuels. I mean, and there's opportunities for communities of kind of leapfrogging fossil fuel infrastructure to go towards more renewable energy that's like localized, there's and community-based healthcare. There's a lot of things that can be done.
So I'll follow up exactly on that because I think I'm one of those people. It feels like most of the proposals right now just aren't going far enough. So I have the view that we have to do a multi-pronged approach through adaptation, technological development, and also behavioral change through cultural change. But the cultural change is going to take a very long time, in my opinion. We'll have conversations and a few drinks leading us to think that we need to go and protest. And one person said we should strap ourselves to the gas stations. This was not too long ago. And I didn't know if that would have an impact or enough of one. So can you say what are you optimistic, pessimistic? You know,
Yeah,
what do
I
you
think
think?
it's a great question. I think that the reality for everyone working in this space is that you can oscillate between those. And I would urge one of the biggest things. So first of all, to say I don't have all the answers, but second of all, I struggle with the same things myself. That where I found the most to be most effective for me in learning from others who really thought very deeply about all of this is in not creating such a black and white discourse that you don't have to be optimistic or pessimistic, that we can be both. We can be deeply like pessimistic, but we can also about some aspects while also seeing that this doesn't mean we give up, because there's always things we can be doing to step forward, and we can always be holding the vision of the world we want alongside the world that we exist in, and just creating space for that and space to talk to each other, and also not seeing it as we have to do everything ourselves, because it'd be very easy to say, well, if I do this, I don't know what the impact's going to be, but actually we never know what the impact's going to be of our actions. Nothing is ever really guaranteed, especially in this very interconnected kind of world, but they can have big ripple effects in how we show up, and we don't know what those ripple effects are going to be. I mean, Greta didn't know. I mean, this is obviously an extreme example, but she didn't know that sitting down with a sign, taking a day off, her first day off school in protest, would lead to ripple effects around the world. Like, so we just don't know. I think that there's evidence with scientists as activists, for instance, that you kind of need to get social tipping points. They're following really good theories of change around, you need to have people who are really on that front line, willing to be arrested, to almost like it almost opened the doors for the other groups to have conversations. Like, you need the extreme groups to pull people forward, even if that people don't agree with the very sort of the more not extreme, but like the more direct action. It can open the doors for other things. But this is also a situation we've never been in before at this scale, and so we kind of need everything everywhere all at once. And so I think it's because these challenges are interconnected. If there's something you really care about, it will be affected by the climate crisis, but also acting on it can often benefit. That this is so deeply interconnected with women's issues, um, with justice issues, with there's nothing that's sort of not affected. So I think it's start. I guess I would just urge everyone to start where you are, and it's that kind of cliche of like think global, act local, but it does actually apply in this case, and it applies in the disciplines that we're coming from, the people that we can connect with, and fundamentally I would say connect, connect, connect. This is Bill McKibben said the biggest thing you can do in the climate crisis as an individual is not act like an individual. That's to paraphrase him, but essentially this is something we need to do together, and it is a marathon, not a sprint. In a way, this is very urgent, but it's also something we can only sustain ourselves in doing this together, and the solutions are really going to come when we hold that space together, because otherwise people are also just burning out, right? Or they're feeling like there's like, I can't reach 1 million people, or I can't do that, so I do nothing, and actually that doesn't kind of help us either. And so yeah, there are wonderful resources I can point people to or send you later to share. There's some great podcasts, great books from people who have much more wisdom about this than I do, but I would encourage you to allow all of those different emotions to exist together, and not see this as a black and white, we will win or we will lose. Like, the future is going to unfold, and it can look many different ways, and there can be quite bleak, but there can also be there can be bright things to find in that, and actually joy and meaning and purpose can really coexist. And even as we lean kind of deeply into the challenge, and actually that only happens though when we like kind of allow ourselves to feel that and connect with others on it.
There's so many things that we can quote you on. The best thing we can do individually is not act individually. Um, so nice. I like your response. Pascal, you can, I think, have the last question. Feel free to unmute yourself. Yeah.
Yes. Do you hear me?
Yes.
I'm not sure if my video works. Well, never mind. My question is again about the finances. You raised that number of 50 billion. I think it's putting a price tag to the problem is always a very good thing to have the attention of decision makers. And my question is, for the moment, most of the governments have financial problems because there are so many things to finance. But my question is actually the costs we would avoid by the amount of money avoided to be spent on mental health problems, or the amount of money we wouldn't have to spend because we breach planetary boundaries. Would that be enough to finance the social and pension systems? I explain myself. We are being told that we need to have a very high growth because if we don't, then there is not enough pension money and social security money for everybody. But on the other hand, we don't start by avoiding costs through fostering a better health for all of us. So it's actually a rat race that will never end. At some stage, we will have to cut and we will say, okay, I prefer a longer life in good health than to a longer life for whatever health or bad health I will have. And that would then make us enter again into breaking the circle of an embedded growth imperative.
Yeah, I mean, I think first of all, it's a great question. There's not details I have to my fingertips, and I'm not also a health economist that I'm working with and would love to learn more from. And so it's actually a question and a point that I'd love to unpack. But just to say that, you know, the subsidies that are given to fossil fuel companies globally, a couple of years ago, I think now, were in the order of 5 to 7 trillion US dollars a year. And the cost of transforming our societies, which alone will come with big economic opportunities, right? For job growth and all of that. If you want to think about growth paradigms, I mean, people talk about, you know, we clearly need to not have infinite growth on a finite planet. But in terms of job creation, you know, this is a huge opportunity. You know, we're gonna need a lot of jobs to transform our society. But that, you know, that money is there. We're giving it to fossil fuel companies right now, and actually the cost of renewables are going down so fast that this is not a problem of do we have it's not about enough money in the world. It's about who's holding that money right now and who's holding that power right now. And it's really a question of massive inequality that is growing globally, and we know that a lot of our problems kind of stem from that. This kind of interconnected kind of common causes, common solutions kind of thing. So yeah, I think it's worth pointing out to people because people feel like, you know, and I think it comes back to the narratives, and the fossil fuel companies have been extremely good at putting out narratives that were about denial and are now about delay and are now about, oh, it's too late, and are now about, you know, it's going to cost too much and all sorts of things. And so people can feel very disconnected from it, very overwhelmed by it, that it doesn't affect them, or there's other problems. But these are deeply interconnected problems and you know, the climate crisis is the biggest risk to our health and our futures and our well-being and our quality of life and our money, quite honestly. I mean, the cost of inaction is growing. I think, you know, there's estimates of like huge percentages of GDP needing to be spent increasingly on disaster recovery and all these things. So it is that kind of a stitch in time saves nine kind of point. But yeah, to your point on, you know, the actual matching up those numbers and building that picture, I'd love to talk more. You probably have a lot more expertise on that than I do. This is why we need the expertise to come together.
Thank you.
Thank you, Emma. We've run a little bit over time. So do you have any final thoughts for us? Anything to close us?
No, I mean, I'd love to hear if people are willing to share. It's always tricky when you're doing things online and I can't see everyone. And I really thank you all for having me and for the wonderful questions. If you had anything that really resonated with you or that you will take away from today, I'd love to hear it if you're willing to share just as you leave. And if anyone would like to get in touch, would like to talk more about this, and I'm sure I could learn a lot from all of you as well. But yeah, thanks for your interest in this topic and for having me.
Thank you, Emma. I think one thing you made very clear to me was you put it in black and white that how multidimensional and compounding the issues are, how difficult it is to do this work, but also how important it is. I see a bunch of emojis, but I don't see anybody else unmuting themselves. So really fantastic talk. Thank you. So thank you very much. I think we'll close there, and we'll take your slides. I very much appreciate that, and maybe I can find a way to post them. I would like to dig more into the solutions.
Cool. Thanks very much, everyone.
Thank you.